The church is very, very clear that on our mission, the mission of a church is transforming the lives of men. And if men have a mental challenge, that is a big challenge to us. So as a church, we want to team up with Mentor 360 and create an environment that is conducive where people who are going through mental challenges can be assisted. We will open our churches so that if they need space and a room, they can use our church halls, they can use the facilities that we have. Also, this awareness is coming to us as church, and we are going to be proactive in supporting our community who are facing these challenges. Economy is a major contributor to mental challenge, because when you don't have enough resources, that means you miss food. When you are asking yourself, where do I get the next meal? When your children are sent away from school, when you don't have sufficient to meet your daily needs, it causes a lot of disturbance in the mind. And I believe that if we can empower our people so that economically they are able to be stable, then part of these mental illnesses can disappear automatically.
But amidst this darkness, there is hope. By fostering open dialogue, raising awareness, and promoting mental health education, we can break down the barriers that prevent people from seeking help. We must prioritize accessible and affordable mental health services, ensuring that no one is left behind and overlooked. Additionally, we must address the underlying social and economic factors that contribute to suicide. This requires a concerted effort from policymakers, community leaders, civil society organizations, the clergy. You're a big voice in this space. You're the key support system. We need you here. The youth, the border, you're the people who interact with people in the villages. You understand what is going on in families. You support people in some areas. We all need to come together. But perhaps most importantly, we must cultivate a culture of compassion and empathy. We must reach out to those who are struggling, offering them a listening ear. Sometimes that's all that's required. A helping hand and a shoulder to lean on. We must remind them that they are not alone, that their lives matter, and there's always hope, even in the darkest times. This project seeks to address the issue by providing youth. We have 12 youth here from across the 12 constituencies in Kiambu with lived experiences of suicidal ideation. We will train them in psychosocial support and train them in psychological first aid, suicide prevention, and community mobilization. These youth representing the 12 constituencies will be expected to set up social support systems in their communities and constituencies to support at least 20 people in the next 1 year.
To amend or to do laws that will be able to support issues or matters mental health. I know currently we have a bill that is to regulate the issue of drug abuse and alcoholism in our county of Kiambu. So today I'm here to tell you that as the county government of the Kiambu Assembly, we are very ready to collaborate with any team, church, non-governmental institutions, and even our society to make sure we have a healthy county. I know there are so many things that we need to talk to our people, and the best thing that we need to address is these people that are sick, they need love, mental health, and I'm happy that most of the speakers, they have mentioned that. It is not something that we need to condemn these people. We start with love, we start with showing them love and accommodating them in every other place. And I'm happy if we can join church, society, and even the government, things will work out. And if we start with love, things will be far much better.
Kiambu has the highest number of suicide rates in Kenya. And also Kenya has 20% higher rate of suicide than the global average. And so it is a key conversation that needs to be had, especially among the youth. So today we are here to launch the NAKUJALI project, which is a project that seeks to strengthen social support systems and empower young people who have lived experience of suicide to support each other and to support others in their community. More than that is to grow themselves economically and engage in advocacy efforts with the county leadership on policy issues when it comes to mental health. First of all, this is a project that we are piloting. It has an element of a study, so we want to find out that when we support and strengthen social support systems for these peers or lived experience youth and empower them economically, will it improve their resilience. And so Kiambu in Kenya has the highest number of suicides, and so this is the reason why we came to Kiambu to start. We hope that this will provide a template that can be replicated across the country to help address the suicide and mental health problem in the country. Kiambu County recorded a suicide rate of around 109 suicides in the county, and for us this is an understated amount because most suicides go unreported because of the stigma that is associated with the problem. Kenya, we've had a number of around 418 suicides over the last 8 months, so it's a problem, and in the news we see every day issues of suicide, homicide, femicides. Some of them are linked to poor mental health, and that's why we are working here. Health issues affect everyone in society. And I think we were just hearing today that the oldest person in Kiambu to die by suicide was 76 years old, and the youngest person was 9 years old. So, and these issues can be attributed to poor mental health. So, mental health issues affect everyone. So now I think, so mental health is a big problem that cannot be addressed by only one person. What we need to do is to come together, partnership, the community-based organizations, the CSOs, the NGOs, the government, the political leadership. This is an issue that affects everyone in society. It affects the people who are underserved or people who are economically challenged, but also affects even the people who you consider coming from good, well-off backgrounds. And so it needs a multi-sectoral, multi-stakeholder approach. It needs a lot of education, psychoeducation. It needs awareness, investment in awareness. It also needs investment in infrastructure, which can only be done sustainably by the government. So we need the government investment in this area, setting up hospitals, or incorporating mental health into primary health facilities. That was key to unlocking and solving the problem for our community. We are now in Kiambu County. We are doing this pilot study here. We are testing. After this, we are keen to expand to other counties. The counties we've identified are Mombasa County, Kakamega, Vihiga County, Kisumu County, Kirinyaga County, and Nakuru County. Other than that, it's also the northeastern part. There's a lot of challenges coming out of there, so we will also be keen to expand to those areas. Generally, we want to reach all of Kenya. That's our goal, because we know these challenges exist in every community.
NAKUJALI project was started because of the high number of suicide and mental health issues in Kiambu. And as a Rafiki, my work is to collaborate with the community, to work together, to help curb the high numbers and the high rates of mental health issues and suicide. I really didn't know who to talk to. Or how to go about how I was feeling, until I met a friend of mine who kind of helped me to realize what it was that I was feeling and what to do about it. She took me through therapy. The first therapy that I went for didn't really help because my therapist wasn't responding to how I was feeling in the right. The rate is high and the community involved isn't really helping. And I can say that for the people who are struggling, they really don't have a place or someone to talk to. They're not free to talk about how they're feeling. Maybe the community around them isn't it's not conception about it, about how they're feeling. So as the Rafikis, we are here to create a safe space for people to be able to talk and to be able to access services that they might need. I'm
Jirin Joroge. I'm a Rafiki in the NAKUJALI project, and I am a mental health advocate environmental conservatist and advocate also. Growing up in an African family and the family that I grew up in, it was not easy. We had a couple of conflicts here and there, and they affected me. I understand conflicts in a family are very normal. It's a sign of a stable and a healthy relationship. But when it extends to a point where it's affecting me and I cannot balance that with my education, it becomes a problem. Now, I was having issues back in campus because I'm trying to be a campus girl, I'm trying to be a firstborn, and my family is not creating an environment that can that is very suitable for my mental health. Yeah. In case of anything, just speak up, because most of the times we lack or we die with our own agony and sorrow because we do not have the strength to speak up and share our experiences. And I specifically love the motto of Mental 360, conversations save lives. Just talk to a friend, tell them how they feel, someone you're free with, because sometimes you do not need an angel. Yeah, and even if we are to offer you help, if we are to offer you therapy, it cannot work if at all you yourself don't want to actually get better. It starts with you. It starts with you actually acknowledging the fact that you need help and speaking up and saying, guys, I need help. This is what I'm going through and I need you to support me and work with me. And that is why we are here as Rafikis, to offer those support systems, the social support that we lack in the society. So yeah, speak up, speak up, speak up.